LabTV. We are America's online video medical network, honoring doctors on the front lines of medicine, including hundreds from America's top hospitals and research universities, and hundreds more from the NIH.
Most important thing to me as a doctor is integrity.
I'm very much interested in improving the human condition.
At the heart and the center of everything is the patient.
LabTV, bringing you this video spotlight.
So when I was 15 years old, I was diagnosed with stage 4 osteosarcoma, which is a bone cancer that is normally found in the appendages, arms or legs. Mine, unfortunately, was found in my spine. Earlier, I was experiencing severe pain down my right leg. It felt like I was having electrical currents just shoot down, and it wasn't until I couldn't even lay down without taking pain medication that we finally got an MRI. That's when we saw that I had a softball-sized tumor in my lower back, and I had about 40 to 50 nodules ranging in 2 millimeters to 6 millimeters in my lungs.
A patient at university hospitals for most of his young life, Stephen J. Urakis is a testament to strength and perseverance. Upon receiving his diagnosis for osteosarcoma while just a sophomore in high school, he spent numerous years in a UH hospital bed seeking treatment. Dr. Tej Pareek, a doctor at university hospitals, is working with Stephen to encourage research into cancer and other related diseases.
So Steve has suffered with a disease called osteosarcoma. At your university hospitals, they discovered a tumor in his spine. They had to give him chemotherapy to kill the tumor when he was 15 years old. And they killed the tumor perfectly fine, but there are side effects which occurred, and then he developed a form of a leukemia, blood cancer. And for that, the only solution at that point, which was there, was bone marrow transplantation.
We knew from the get-go that the only chance I had for a cure was to find a bone marrow donor. 2 months into my treatment, we found I had 3 matches, which is unheard of. There's 3 things that can happen. The bone marrow takes and you live, the bone marrow takes and it kills you, or it doesn't take at all. You know, every day you're waiting to see that count go up. You know, you're like 0, 0, 0.1, but 0.1 doesn't really count as enough cells to say you're growing cells. And then finally, the doctor at the time, he called the nurses at 5:30 in the morning, 6 o'clock in the morning, and he's like, "Have you seen his counts yet?" I'm like, "No, we haven't." Like, "All right, well, can you patch me into his phone line in his room?" And the nurse came in and was like, "Steve, Dr. Laz on the phone right now, he wants to tell you something." And he just goes, "Your cell count's up. Your cells are growing." Being a religious person, it turned out that that day, because I'm Greek Orthodox, that day was for us the day Lazarus rose from the dead. So it was kind of being reborn as a new person. Just very grateful.
Hey, hi Steve. Very nice to meet you. It's good to meet you. Yeah.
Steve's traumatic yet miraculous recovery was, needless to say, life-changing. After overcoming his cancer, he went on to start the Stephen G. AYA Cancer Foundation, an organization founded to fund adolescent and young adult cancer research.
The truth of the matter is I never wanted to be involved with cancer advocacy. I never wanted to come and help out at the hospital. But during this experience, I had met people who were sick, and actually during my first cancer, I never left my room because I knew that I would meet children who possibly wouldn't live. And there was a little girl who was in my cousin's 3rd grade class, 4th grade class. She was 9 years old. Her name was Emily Lewis. She passed away the summer after I had my bone marrow transplant at the age of 13. I thought, you know, sitting here going, I've beaten 2 cancers and she never even had a chance to get into remission. I don't know too many people in the world that could be told they're going to die and just live the next 2 months like everything was fine. Did her crossword puzzles, read her books, didn't change anything in her life. And she was by far the strongest person I've ever met before in my entire life. So when she passed away, I was kind of like, all right, pardon my language, but you know, it's time to pull my head out of my ass, and you have the ability to help people. So let's do that, you know, what would she do? So from that point on, I've lived my life as, what would Emily do? What would she want me to do? being a survivor, I take the idea that since I have lived through this disease and I have survived it, it's now my job to be the best that I can be, the best that humanity has to offer, the survivors that have lived. We've been through something that most people haven't been through. We have a view on the world that most people don't have. She really did totally affect my world in every which way.
Today, it has been 10 years since Stephen was first diagnosed with cancer. Thanks to the innovative medical staff at university hospitals and Stephen's partnering devotion to fund research, countless cancer patients now have a new reason for hope.
I think one of the great opportunities what we have in this lab and this whole collaborative environment in university, it is not the team of scientists, researchers and lab assistants, but it is also a team partner of the community and patients. So what we are doing, what exact research what we are doing, we try to communicate this to our patients and we make them our partner in that discovery team where they become advocate of what we are doing and advocate for the disease per se. Allowing us to see them more closely will give them better solutions for the future.
This hospital is incredible, but what makes the hospital incredible and the wonderful place that Rainbow is the people. The way patient care works here, it goes patient, family. So it's not just the patient needs that are addressed, it's the family's needs that are addressed, which is important, because it's not just, cancer doesn't just affect the patient, it affects the parents, it affects the siblings, it affects the whole family. The people here do a wonderful job. The way they really do try and use new forms of treatment, new forms of technology. I mean, this clinic here, this outpatient clinic here is incredible. It's the only one that's really like it in the state and really probably in the country.